ahead and start. So, hello everyone, and welcome to Parkinson's Place. May is Better Hearing and Speech Month. So today I'll be talking about how one's communication is affected by Parkinson's disease. So according to the Parkinson's Foundation, 89% of people with Parkinson's disease experience speech and voice disorders. So that is quite the amount of people. So my goal today is to educate everyone on symptoms to look out for and what you can do to improve your communication. My name is Shannon Paoli. I am a speech language pathologist. I was born and raised in Sarasota, Florida, and I've worked in various settings such as hospitals, skilled nursing facilities, home health, assisted living facilities in Manatee and Sarasota counties since 2007. So I've been doing this quite a while and gotten to know a lot of people with Parkinson's in the area. And of course, for those of you who already know me, I lead the Say It Loud and Clear exercise class for Parkinson's Place, and we do that once a week. And it's an exercise class for your breathing, your voice, and your speech. So let's talk about how Parkinson's disease affects speech and what we can do to help it. So as we know, Parkinson's disease occurs when there's a disruption of flow of dopamine, and this results in both motor and non-motor symptoms. So motor symptoms are things that include your walking, your talking, your speech, your swallowing. Non-motor symptoms are things like your cognition, your thinking, your memory, your feelings, your sensory system. So it makes sense why so many people with Parkinson's disease have difficulties with communication. So communication is how we make our needs and wants known. An impairment of our communication may lead to physical and mental illness. What I mean by that is if you can't express to somebody that you have pain or where the pain is located, you might be experiencing an infection that doesn't get treated. And if you're not talking to somebody, if you're not able to communicate, then you might become depressed because you can't express your feelings. So if somebody's having communication difficulties, it becomes frustrating and they might just avoid people in situations and just stop talking. And when you aren't talking, you're not using those muscles. I always tell people, think about when you were younger and you were working or raising a family, going to school. Think about how much you talked, how much you were using those muscles compared to how much you're using them now. So you're not getting all that exercise, but of course, before you didn't consider it exercise, but you're certainly not using those muscles as much as you used to. So in order for there to be good communication, there has to be an effective speaker and a listener. So like they say, it takes two to tango. So later on, I'll be talking about how there are not only communication strategies for the speaker, but also the listener. So let's start talking about those non-motor symptoms that affect communication. So those are things like one's cognition, their language, and their hearing. So somebody with Parkinson's disease might have difficulty with their thinking, their memory, attention, processing speed, organization, and sequencing. So for example, Somebody might have difficulty telling a story or maintaining a topic. They might put it in the wrong sequence and then get a little confused about what they're saying. Language is both your comprehension and your expression. So it's what you understand and how you express yourself. So somebody might need a little extra time to process the information or to express the information. So a person with Parkinson's disease might be perceived as being confused because they might respond to a conversation that ended minutes ago. So the listener has moved on to a new topic, so the response appears inappropriate and they think, well, they're confused. What are they talking about? Not realizing that that was the previous conversation. And language goes hand in hand with cognition. So in order to follow multiple directions, you gotta remember what they are. You gotta process all that information and know how to sequence it with your body. So somebody with Parkinson's disease might only have received or recalled the first step and not the additional steps. So if it's multiple directions, they may seem confused with their response because they just recall or remember the first thing. So it's important to give the person a little time to understand and to respond to information. So our language isn't just about our speech, but it's our words. We've all had moments that you forget a word. You're telling a story and you go to say something and you know what it is. It's that on the tip of your tongue, but it's just not coming out. Somebody with Parkinson's disease might experience that a little more frequently. And what happens is that they are so desperately trying to find that word, then they lose their train of thought. And then you just think, never mind, forget it. So then they don't finish their communication. And then, of course, hearing is important for communication. We want to make sure that the person understands everything we're saying, because how can they respond appropriately if they don't understand? So an example is like, let's say I want to tell the person I'm working with that has Parkinson's that I say, hey, I got to run out to my car. But they hear that I'm going to run out to the bar. So they make a comment like, well, get a beer for me. And you think, what are they talking about? I don't have beer in my car. So something as simple as that can make it appear that either like the person is confused or they're saying the wrong thing, when in reality, they're just simply not hearing the correct information. So if you guys are able to see this picture on the bottom of here of the three people, this is an example. The guy in the middle is talking about something and he looks happy. His hands are out and he's telling a story and he thinks he's saying everything correctly. But the one listener thinks he's talking about one thing. The other listener thinks he's talking about another thing. So none of them are on the same page. So it definitely impairs communication for all people. So it's understandable how communication deficits are frustrating for not only the speaker, but the listener. So let's start. I don't know when I shift around this video, if it shifts it for everybody or just me. So let's go ahead and talk about those motor symptoms that affect communication. We're going to start with the nonverbal communication. I'm sure you've heard in the past when people talk about how it's more important how you have your nonverbal versus the actual things that you say. So those things, those nonverbal communication includes your gestures, your facial expressions, your eye contact, and your body posture. So we know that sometimes people with Parkinson's has the hand tremors. So while I'm sure you've noticed that I tend to use my hands a lot when I'm talking, but we tend to use gestures to supplement our speech so that, we point to something, or if we want something, we can use a hand gesture. But somebody with Parkinson's disease might not use those gestures because they know they have the tremors, so they're going to avoid the hand movements. Facial expressions are important so that we can let the listener know how we're feeling, how we're responding to them. So you might hear the term facial masking or a flat affect. That's when there is stiffness and slowness in the muscles in the face. So it might give off the appearance that somebody is like uninterested or annoyed with what you're saying to them. So if you look at my little faces on the screen here, if I had taken away the words below all the faces, you would probably understand what emotions each little face was conveying. The last one there, the one that says bored, well, there's not much of an expression on the person's face at all. That is something oftentimes people with Parkinson's may display without realizing it. So they might feel happy or they might be listening to a conversation, but because those facial muscles aren't really working properly, it gives the impression that maybe they just don't care. And eye contact is important during communication. Oftentimes we notice that people with Parkinson's might have that hunched over posture or their head is down. Therefore, they're not making eye contact. And that could be perceived to the listener, again, that the person isn't interested or they're not paying attention. So obviously for communication, again, we want to make sure that the speaker and the listener are on the same page. So we said body posture is not only important so that the listener gets the right message from you, but the sound is coming out properly. When somebody has that hunched over posture and their head is down, it affects their voice. So if your head is down towards the floor, that means your voice, the sound is traveling to the floor. And we want the sound to be traveling towards the person. If we've got that hunched over position, then we're not using the full capacity of our lungs. A lot of times I'll see people that tend to just do these short little breaths, or they just use the top of their lungs. And that could be because they are hunched over. And when you sit up straight, it's easier to take a nice deep breath in. So when you get that nice deep breath in, that's like the fuel for your voice. That's what makes your voice louder. So posture is very important. All right. Some other motor symptoms that affect our communication is our writing. So somebody with writing might have those hand tremors that makes it difficult to read their handwriting, but also they might experience something called micrographia. It's when you're writing and you start off nice and large print, but the more you write, the smaller it gets and the harder it is to read. So oftentimes, if somebody is having difficulty with their speech, we might ask them, well, write it down. Well, somebody with Parkinson's might have difficulty writing it down. So that's something to keep in mind. And of course, as we age, just like our hearing, our vision changes. So somebody with Parkinson's might have difficulty with the eye movements, so which again will cause difficulty with maintaining or even making that eye contact. Eye contact is important, not just to see like your facial expressions, but to read lips. A lot of times, people that are hard of hearing, they want to make sure they can see your lips so they can understand what you're saying. All right. And I love this picture, it cracks me up. It took me a second to realize what was going on in this picture. So another motor symptom that affects communication, believe it or not, is your swallowing. So this lovely gentleman here clearly has swallowing problems because he swallowed a whole turkey leg that is stuck in his throat. So I certainly do not advise that. So how is your swallowing affecting your voice or your speech? Difficulties with your swallowing is called dysphagia. So that means you have trouble swallowing. It could be foods, liquids, even your saliva. So if you have extra saliva in your mouth, you might not talk as much or talk as loudly because you know your mouth is full of saliva. And once you start talking, all that saliva drools out. So you don't want the saliva to drool out. So maybe you're just shaking your head instead of actually talking. That saliva might also build up in your throat. So when you go to talk, you have a really like wet, gurgly voice. And that is often difficult to understand when somebody's talking with that wetness in their voice. And eventually it'll cause you to start coughing or choking. So then that interrupts your communication. And again, the person can lose their train of thought. So then the opposite problem may happen too, is let's say the person doesn't have enough saliva. Our vocal cords and our articulators require moisture for everything to come out nice and clear. So if we have all that dryness in our mouth and our voice, when we go to speak, it's like almost nothing comes out. You might particularly see this happening like in the morning. Oftentimes I'll see people that sleep with their mouth open at night. So when they wake up, everything's just really dry in there and they go to talk and they have no voice. So they have to sip on some water and get everything nice and moist. And there are products out there that help with the moisture. If anybody's ever heard of biotin or use it, different products to help with your moisture, because some people, as a side effect of the medications, can really get the dryness. So, and relating your body posture to your swallowing is when you have this head down posture and you have that extra saliva, it all kind of goes to the front of your mouth and starts dripping out. So again, when people feel all that saliva in there, they don't want to talk. All right, so let's get to the part we all want to talk about, which is specifically your speech. But you can see how all the other things that I talked about relate to your speech in one way. So our speech is our ability to express ourselves through articulated sounds. So if you look at this little picture I have, it's a picture of looking at somebody on the side view of them. So you see their lips, you see their tongue and their palate. So in order to have sounds come out clearly, your lips, your tongue, your palate have to get in specific locations in order to make the sound come out clearly. So speech is actually a very complicated process. It's something that we don't think about because it's something you've always done. You never had problems with it before. You don't think of it as being a problem. So for your speech to come out clearly, you have to coordinate your lips, your tongue, your jaw, your cheeks, your palate, your vocal cords, and your breathing. So if one of those areas has any impairment, it can affect everything else. So any sort of weakness, any sort of tremors can affect your speech. You might have heard of the term dysarthria, and that's in reference to somebody's speech. Dysarthria is a motor speech impairment, and it affects your muscles that produce your speech. So if those muscles are weak or damaged or paralyzed, and there's different reasons that one might have dysarthria. If you have had a stroke, like a brain injury, and then Parkinson's. So there is different types of dysarthria, and it all depends on the location of your brain that's affected. So the most common form of dysarthria for Parkinson's disease is called hypokinetic dysarthria. So characteristics of somebody with Parkinson's disease, their speech is typically quiet and breathy, monotone. So the pitch is the same. It's almost robotic. Hi, how are you? I am fine. So you don't have those ups and downs in your voice. And that monotone voice makes it very challenging for people to understand what you're saying, especially if somebody has hard of hearing because they don't have those changes in pitch. Hoarse vocal quality, vocal tremors, change in rate of speech, the imprecise articulation. So if somebody has dysarthria, it can sound like slurred speech or mumbled, or almost they'll say like drunken speech. So typically what I've seen with people with Parkinson's, even sometimes people don't say they really feel like they have a problem, but the more they speak, the more you can tell that they're having some difficulties. Their voice might start very loudly, but the more they talk, the quieter it gets, the faster it gets. And by the end of what they're saying, you can barely understand anything they're saying because they don't have that breath support. They don't have that volume. They're talking very quickly. So speech and voice go hand in hand. So let's go back again to that good posture. I was saying that you need that posture. That means that your head is up, your shoulders are back, and you're not hunched over, because that's what gives you your full capacity of your lungs. It's very important that we have that nice deep breathing. They call it the diaphragmatic breathing because it circulates the air throughout your lungs. So instead of just covering the top area, we want to make sure it gets all the way to the bottom. So we don't want anything collecting in our lungs. We don't want to get any infections. We want to have all that nice good volume, all that good air for our speech. So not only do they need that good breath support to be loud, but to stay loud. I was just saying, often people become lower and lower with their volume. We want to start loud and stay loud. We talked about changes like in their prosody, that rate of speech, that change in pitch. We want to make sure that everybody can hear everything that you say. So you want to have the ups and downs in your voice. And then vocal quality. Hoarseness is often seen in people, and they might relate it to, oh, I just have allergies, which is a very good reason to have the hoarseness, but it could just be because of the Parkinson's. So your vocal cords are these two muscles in your throat, and what happens to produce your speech, they come together. Not only do they come together, but they have to vibrate too. So they need to be moist. So that's why it's important to sip on your water throughout the day. And if there is a gap in those vocal cords, they don't come all the way together like this, that means all the air is escaping. That's where you can get that really breathy or quiet voice. We want to make sure those vocal cords come together so the voice comes out nice and strong and loud. So if you are shouting all the time or you're whispering all the time, those are actually things that could be contributing to hoarseness. So you want to make sure that you have a good quality voice. So, and again, keeping hydrated, sipping on that water throughout the day. And by sipping on water throughout the day, it also helps with that saliva. It reminds your brain to not let that saliva collect in the front, to push that saliva to the back and swallow. So we think about all the things that I've talked about so far, that all these things that affect our speech, our communication. It's no wonder that almost 90% of people with Parkinson's have difficulty with their speech and their voice. So in addition to those difficulties, there's one more thing that we noted through research, and that it's somebody's perception of their speech. Sometimes people with Parkinson's often don't recognize that there's a change in their voice. So they think that maybe their caregiver, their loved one, whoever it is, they say, well, they have a hearing problem, or they just never listen to me. Or they feel like when they are being loud enough, it feels uncomfortable. It feels like they're shouting. They have to put more effort into it, so it doesn't feel right. They are afraid that they're offending people because they think they're yelling at people, while the listener can hear them clearly and they think it's great. The person with Parkinson's doesn't want to use that voice. So, how do you know that you've had changes in your speech or your expression? Well, they might just be subtle changes. You might notice, you're changing your lifestyle a little differently, but you don't think about the reason why you're doing it. So, for example, you may notice at the end of the day, your voice is worse, but you think that's not a big deal. Or if you're still working, maybe you've decided that maybe you shouldn't do the presentations anymore. Somebody else can do it. Or some people have told me they used to volunteer, but they stopped doing that because of their voice. You might have some apprehension about going out to eat. Those restaurants can be very noisy with all that background noise, and you don't want to compete against it. Or if you're around a large group of people, you feel like every time you try to talk, maybe somebody talks over you. So if you find yourself repeating yourself, people are asking you, what'd you say? What'd you say? Can you repeat that? Then you might have some difficulty with your speech and your voice. If you feel like people are ignoring you, maybe it's just because they can't hear you. If you find yourself running out of air, like I said, you're talking and everything's great, and then all of a sudden it goes down, 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 down. And then you'll have all those characteristics that we just talked about. Now that you are aware, now that I've educated you on things to listen for, you might say, well, yeah, I guess I don't have much changes in my pitch, and maybe I am not speaking as loudly as I thought I was, or my voice is hoarse more than I thought it was, or I've noticed some fatigue as I'm talking. Sometimes people will have a conversation with a loved one that's out of state, and they don't want to get off the phone because they don't talk to them that much. So they find out after talking for 30 minutes straight that their voice is really weak and tired. They might have that mumbled speech, or find themselves talking really quickly to hurry out and get everything out before they run out of air. So there's a lot of things to look out for, to try to monitor yourself and figure out, is my speech good? Can other people hear and understand me? Because typically that's not something you think about. You never had problems before. So you got to kind of retrain your brain. So again, communication is very important for our quality of life. If you can't express your needs and your wants, how do you tell somebody, let's say if you're out at a restaurant and you're trying to order food and the waitress doesn't hear you correctly and you get the wrong food. Something like that is a big deal. When you're talking to others and you're trying to tell them a story and the words aren't coming out quick enough or loud enough, and they just kind of cut you off, it makes you feel very unimportant. You feel frustrated because you know what you want to say. It's in here. It's just by the time it gets to here, it doesn't come out correctly. So again, you might be perceived as being confused, and it's frustrating because you're not. It's just that you don't have that coordination. It's like walking. When people have that shuffling gait or that freezing, the same thing can occur with your speech. You start like with your walking, you start with those nice big steps and they turn into little shuffles. That can happen with your voice. It starts nice and loud and then it turns into these fast, quick words. And then sometimes, like I said, people just give up. They say, I'm not going to talk anymore. Nobody understands me, or nobody thinks that what I have to say is important, so why talk at all? I oftentimes, I'll go to somebody's house and it's like a couple that's been married for years and years, and they're like, well, we don't talk that much. We've heard each other's stories a million times. And then unfortunately, because of COVID, you're not out and about socializing and talking to other people. So people don't talk that much, and they're not using their voice. So they're not stimulating their brain. They're not using those muscles. So just simple things like having a conversation, reading something out loud, doesn't sound like anything, but it does make a big difference. So despite all these negative consequences I talked about with decreased speech, out of those 89% of people that experience problems, only a very small portion will seek out treatment. And there's much research out there that tells us that people with Parkinson's can improve their voice. They can improve their communication. So sometimes people feel like it's just part of the process, or again, they don't feel like it's important, or they don't have a problem, so they don't look for treatment. So Of course, my advice as a speech language pathologist is to seek treatment. So, not to wait, to try to seek treatment as soon as you notice that you're having some difficulties. So, what you would do is you would ask your primary care physician or your neurologist. You would say, hey, I've noticed my speech is getting worse and I don't want it to continue to get worse. Can I please see a speech therapist? And I guarantee you they're going to tell you yes, because it's well known that people with Parkinson's experience this difficulty. So there's different places that you could get treatment from. You could go to an outpatient clinic. There's lots of telehealth services now these days, especially since COVID. Or you could have home health services. If somebody is considered homebound under Medicare, they qualify for home health services. So being homebound doesn't mean you can't leave your house at all, but you just leave for the essential reasons like doctor's appointments or haircuts, but you're not like going out to the clubs and the casinos and the movies every week. It's just that you can even just go out to the grocery store or something like that. And especially now with COVID, they're a little more lenient because of the possibility of the virus out there. So it's something to talk to your doctor about. So once you get that referral to go see a speech therapist, what the therapist is going to do is look at more than just your speech and your voice, because like I said earlier, it's not just your speech and voice. They got to look at you as a whole person. So not only they want to see how you have strengths and weaknesses with your speech, your voice, your language, your cognition, your swallowing. We want to see what your lifestyle is, what's important to you. Some people may still be working and they want to make sure they have a good voice to maintain customer service or talking to coworkers. Some people, it's important for them to be able to call their dog and have their dog come to them. So whatever it is that is affecting your quality of life is what we want to work on. So, and when you see a speech therapist, they're going to establish a baseline for you so they know, they collect data, they collect measurements, so they know where you're at. So that way that we can give you those numbers, those objective measures, so you know how you're doing. And they're going to recommend an individualized treatment for you, because again, everybody's different depending on, even like your medical situation, your living situation. So you and your therapist can come up with the best plan, and everybody's different, but as long as you have a plan and you're doing something about it. So there are two popular speech and voice-centered programs out there, specifically for people with Parkinson's disease. So the more popular one is called LSVT Loud. So I'm sure at least one of you out there have heard of that. Oftentimes you hear about the Big and Loud program. So the big portion of the program is led by a physical or occupational therapist, and they work on your movements. The loud portion of the program is led by a speech therapist, and it focuses on your voice. So it's called the Lee Silverin Voice Treatment Program. And they've done a lot of research, and this program is successful. In order to participate in this program, you have to follow the specific protocol. So it requires a speech therapist that has been certified in this program. And before you can actually do the program, you have to have an ear, nose, and throat doctor or your primary care physician view your vocal cords to make sure they're healthy, because this is a very intensive program. You use your voice a lot. So if there's something wrong with your voice, like if there is some swelling or something on your vocal cords, this can actually produce some damage. So they want to make sure that you have a healthy voice for this. You have to be willing to participate in 16 one-hour sessions, and that's 4 consecutive sessions a week. So that is a lot for some people to commit to, but other people are fine with it, especially knowing that it's going to produce good results. So it is a hierarchy of tasks, which means you start with like practicing at word level, phrase level, sentence level, paragraph level, and the idea is you end up with having nice, loud, good communication during conversational speech. So not only are you required to attend those speech therapy sessions, but you're also required to practice at home. So on the days that you receive the therapy, you're required to practice an additional time at home. And it's about only like 15 minutes when you practice at home. And then on the days that you don't go in for therapy, you're required to practice twice a day. So, and not only do they expect you to use your skills during the therapy and during the homework, but to use these things when you're talking to somebody. So the whole idea behind the loud program is they tell you, think loud. They want you to keep that in your head, because they've done research. Just by being louder, you tend to increase your breath support and your articulation. And actually it can help with your swallowing too, because all the muscles that you use for your speech are muscles that you use for swallowing too. But again, in order for this to be successful, they want you to have this to be a lifelong thing that you do, that you practice every day. And they also encourage people to participate in group exercise. It's called Loud for Life. And it's just, right now it's on telehealth, I believe. They used to gather together before the virus, but you would get together with a group of people, go over your exercises, and then you practice with each other, giving your nice loud voice. The other popular treatment is called Speak Out. So this is based off motor learning, similar to the other program where you're doing a repetition of certain exercises. But for this one, you don't have to have the ENT view your vocal cords, but you are required to watch an educational video, and so is your loved one, your caregiver. And the video goes over the reasoning, the rationale behind the treatment, because they want you to be invested in it. And the idea is that you speak with intent, that everything you're saying, you want to make sure somebody else hears. If you have Parkinson's and you get very upset, you might notice your voice comes out really good because you really want to make sure somebody hears how you feel. So it's kind of like that. You want to make sure everybody hears everything you're saying all the time. So this treatment isn't as intense. It's less sessions, and it's based on how the person's progressing. So it might be only 9 to 12 sessions compared to the 16. And they don't have to be 4 times a week. And the duration is less. So some people like this program better because it's a little more flexible, but it still requires daily homework. And they want you to have a follow-up assessment. in 6 weeks to check to see how you're doing. And they also have a group exercise class called the Loud Crowd. And it's the same idea. You go over your exercises and your homework and you practice with people other than like your caregivers and your family members. So it's also almost like a little support group. So you can help others. Another type of treatment out there is for your breathing. It's called expiratory muscle strength training. So that's the muscles used to like breathe out, to cough. So it's training those muscles by providing resistance, and the results lead to increased breath support. And like we said before, if you have more breath support, then your voice is going to be stronger. So there's a couple different options for this. This device, EMST, sometimes I've used it with people and they find it a little challenging. So they've actually come out with this light version of it that isn't as difficult. So with these devices, you blow into this device and it has a resistance on it, like a spring, where you have to open the valve and therefore strengthening the muscles. The breather actually uses your inspiratory and your expiratory muscles. So with this device, you breathe in and blow out. And with my experience, sometimes what I'll do is start with the breather with people and then move on to the EMST, because the breather is a little easier to build up those muscles. And then sometimes we just need some kind of backup for our voice. So if there's a particular time of day that you struggle with your voice, then maybe you need some kind of compensatory strategy. So for example, up here I have a picture of a voice amplifier, something that you could just purchase on Amazon. So when your voice is really low, you put the microphone on and you turn up your volume on the speaker so that people can hear you better. We talked earlier about writing. Sometimes people still have pretty good writing, and if they need that vocal rest, either after a long conversation, they can supplement things with their writing. Sometimes people may need like a picture, a word, or like a phrase board. And that's just basically like a sheet of paper. And it could have pictures on it, words, phrases, things that you would commonly say. It could be something like, I need my medicine. So if your voice is out that day, you can just point to it. Some people would prefer a letter board. And again, that's basically just a sheet of paper and it's set up like a keyboard. So instead of typing in, you can just point to it. And there's many apps out there. There's like text-to-speak apps where you text in a phrase and then it'll speak it for you. Just a couple weeks ago, I was treating a patient and he was talking about when he talks to somebody over the phone, it particularly makes him anxious and frustrated. So he lived in a community that if somebody was coming to visit you, you would have to contact the gate guard. And that just really made him anxious. So what he found to do was to use that text to talk. He would text out the information like, hi, my name is Bob. Shannon's coming to see me. So when he called the gate guard, he could just play that message. And then there's communication devices out there that you can purchase. And if you have Medicare, they will pay, I believe, 80%. And this device is like a tablet, and it comes programmed with software that has a bunch of pictures on it, and you touch the picture. So for example, if you touched restaurants, and then you could touch Applebee's, and then you could touch sirloin steak. So if you're having difficulty with your voice, then that way you don't have to rely on somebody else. You could use this device. So we talked about before that communication not only requires the speaker, but the listener. So, of course, we've talked about numerous times as a speaker, you want to have that good posture. You've got to have that head up facing the listener. You want to make sure your voice travels towards their ears. You want to turn off any background noise. You want to state your topic before you're speaking, because like I said earlier, sometimes you might be responding to something that you were talking about earlier, but your listener forgot about that. So you might have to tell them what you're talking about. You got to make sure you're taking that nice deep breath before you speak and use it. Oftentimes I'll see people taking a nice deep breath, let it out, and then start speaking. We want to use that nice deep breath. You want to make sure you're articulating. When your lips are not moving and they're just barely moving, all that sound gets mumbled inside. So you got to make sure that mouth is open so the sound comes out. You want to be loud, but you don't want to be shouting or screaming. And you might just have to speak in shorter phrases. Because I was saying before, as you talk, your speech diminishes more. But if you say phrases, everything might come out beautifully. All right, what about that listener? So again, we want to make sure there's no background noise. We want to make sure that they can see your lips. And we want the listener to be patient. Give the person some time, knowing all the different things that could be going on with them. The slow processing speed, the word finding problems, the stiffness in the muscles. Give the person some time and let them know when they're using that good voice. Tell them, that was wonderful. I heard everything you said. And repeat information if you're not sure of what they said. So if you think of earlier, my example of saying, you're going out to the car, but the person thought you said you were going to the bar, they could say, well, why are you going to the bar? So that would be an easy way to correct that miscommunication by repeating what the person said. And we want the listener or the caregiver to reinforce those speech strategies learned in therapy, because as we know, sometimes the person doesn't realize they're not speaking loud enough or clear enough, especially when they're doing other tasks. So when I lead the group every week, everybody repeats everything that I'm saying. And a lot of time, well, I can't hear everybody over the computer, but when I see somebody one-on-one, they repeat information, they repeat the exercises, their voice sounds great. And then I'll start chit-chatting with them and their voice is really low because maybe they're trying to recall some information or tell a story. So we know that they can get their voice loud, but when they're doing something else, it drops again. So we need to reinforce, are you using your loud speech? Are you speaking with intent? Whatever the phrase is, to remind the person to speak clearly. And of course, encourage that daily practice. So my recommendations is, if you're having any problems, seek out treatment. Because with my experience, that it is so much easier for people to maintain than to restore function. So once you start having that problem, start training your brain to do the things you need to do. And that's why it's so important to do that homework every day. So whatever homework the therapist gives you, that's so important to do. And like I said, a lot of times it might just be 10, 15 minutes a day, but that's 10, 15 minutes make a huge difference. Sometimes people will say, well, I'm good now, I don't need it, or it's boring, I don't want to do it. And then next thing you know, a couple weeks go by and their voice is down again. So then they have to do a lot of work to get her right back to where it was, where if you just do those things every day, it's easier to maintain it. And of course, keep hydrated. So you want to make sure, especially going into the summer months, that you keep sipping on that water. So the last thing I wanted to do, we often do this in the class that I leave, is a tongue twister to show you how your speech can sound differently depending how it's produced. So I probably shouldn't have picked this one because this is the one I mess up the most, but that will just show you what I'm talking about. So I want you guys to say this at home, and I want you to say it nice and slow and clearly. You're going to project your voice across the room like it's something really important that you want somebody to hear. So everybody say, which wristwatches are Swiss wristwatches? So even saying it slowly, it's a little tricky. But now I want you to say it quickly. Which wristwatches are Swiss wristwatches? So if you try to say it quickly, you can see, one, I morph into this monotone voice. I don't have the ups and downs because I'm quickly trying to get it out. My volume has dropped and it's not clear. I do some slurring and stumbling on the words. So when people speak quickly, it doesn't come out very clearly. So we got to tell them to slow down. And a lot of times, just by being louder, you kind of naturally slow down. People don't typically talk loudly and quickly. So that is the end. All right. So if you muted yourself, you can certainly unmute yourself if you have a question.
Shannon, I got one question.
Yes, sir.
Do you have loud crowd group sessions in Sarasota?
There are, yes. I know Sarasota Memorial Hospital was doing it. I'll have to check with them for sure if they started them up again, because I know their outpatient clinic centers were doing them. So there was 2 of them. Unfortunately, I've learned a lot of places in Manatee County don't have a lot of resources for Parkinson's. We're very fortunate in Sarasota that we've got 2 places that have resources for Parkinson's. And, you know, it's so wonderful. You know, it's so horrible that we've experienced COVID, obviously, but it's so wonderful that we're able to offer these programs online. And, you know, I get to see the people that would normally be up north now. So I know if you can't find it in person, they have those loud crowds or Loud for Life on the internet.
Okay. Thank
Does
you.
anybody else have any questions for me? So hopefully you learned something new today.
Manatee Hospital does have classes.
Oh, they do? Okay, good. That's good to know. I wonder if Blake too.
I don't think so.
No, I think it was Manatee.
It was Manatee. Okay.
Yeah.
Yeah, I kind of took a pause with COVID about who does them and who doesn't. So now that everybody's coming out and about more, I really should get a list together. Yes?
Hi, Shannon. My husband does that online with Samantha, the loud class that Speak Out.
Okay.
But she's so very thorough that it takes 34 minutes could be, I think, done a little quicker because his attention span. I wanted to tell you, my husband has advanced stage Parkinson's to the point where I hate to say it, but he can't sit up straight. He gets very tired. He can't speak above a whisper except earlier in the morning or at night, maybe when he's more relaxed, later at night or something.
Mhm.
I feel, I see it, that there's a point of no return here, no matter what he practiced, how much he practices.
Mhm.
So we were with a friend yesterday and he just couldn't even finish, and the whispering was so soft, I couldn't even help.
Mhm.
And then we had to just stop what he wanted to say. So do you see that? There is a stage at the end towards, not end, but yeah.
Right.
No
Yeah,
matter,
that's where those like communication can come in handy. You know, we still want the person to be able to express their, at least their basic needs and wants. So something like a communication device, so they can just point to something.
and the program is good because it at least exercises his vocal cords for swallowing. And she always says, drink the water now. So I see benefits from that, even if he can't really have a conversation anymore with our friends.
Yeah, definitely. Like I said, people just don't, you retire and then between COVID and so many reasons people aren't using their voice as much. And it really is a big difference on getting exercise now compared to before. So, I'll tell people, read the newspaper out loud, read the book out loud, just that little bit of using your voice makes a big difference.
That's not Jordan, is it? No, it's not Jordan.
Shannon,
Yes.
Which one?
is there a list of people who lead the LGBT loud classes?
Yes, if you go on their website, then it should give a list of those that are certified.
Thank you.
You're welcome. Anybody else have any questions? And of course, I'm available every Tuesday at 10 o'clock during our classes. The classes that I do they don't follow any specific protocol. I try to do a little bit of everything. So we do, breathing exercises, neck stretches, voice exercises, speech, some cognitive tasks. So I just try to do a little of everything. It's not a part of the loud program or the speak out. But again, it's something to get people to practice. And at the very least, I feel like, it helps your breath support. It reminds people to get that nice deep breath in. People will automatically start speaking louder once they start doing these exercises. And it is good for your swallowing. You're using those muscles. So, anything else before we part ways?
Thanks, Shannon.
Thank you, Shannon.
That was
Thank
great.
you.
Thank you.
Bye-bye.
Bye.
Bye-bye.